All right, so we are going to be answering this question. Describe the anatomy, the function, and effects of lesion on the cerebellum. And it has been asked. You can see how repeated in recent times, although there were even times in the past where it was asked in 2021 MB1, 2023 MB1, and even in receipts of 2024. So we have an outline that can help us to really go through it. Introduction, anatomy of the cerebellum, where I will talk about the functional layers, and I'll also talk about the deep nuclei and the neurons, otherwise called the cells. I'll add a diagram because it's necessary you add a diagram. Never leave physio essays without diagrams. And then functions of lesions, and there are about 6 of them. I'll tell you how to remember, and effects of lesion, about 11 of them you must remember for your exams. Now, what's the introduction I will use? The introduction I'm going to use is that the cerebellum is a structure of the hindbrain. Is a structure of the hindbrain that is located in the posterior cranial fossa. Okay, the function. Now, for the function, I would have mentioned the function. If it's other essays that the function was not actually given in the question, I would have said which function saying this, and that. But now the question is really saying that, oh, please put functions separately. So I'll leave it at that. So I'll say a part of the hindbrain located in the posterior cranial fossa and attached to the brainstem using what we call the peduncles. Using the peduncles. Let me show you what I'm saying. Now we have the brain like this, the cortex, the midbrain, the pons, the medulla, and then the spinal cord. And then at the back, you are going to see the cerebellum. Now it is joined together by the peduncle because this is the midbrain here, this is the pons, and then this is the medulla. So this is the superior peduncle. The one in the pons is the middle peduncle, and the one here is inferior peduncle. You are looking at the section from the side. Now let me look at it. We take a cross section like this. You see something like this. We have the parietal lobe, the temporal lobe, parietal lobe, and then temporal lobe. Midbrain, pons, medulla, and then spinal cord. And then by the side again, we have the cerebellum joined together. The peduncle here, superior peduncle, middle peduncle, inferior peduncle, superior, middle, and inferior. So I've been able to show you that the introduction says it's a structure of the hindbrain that is located in the posterior cranial fossa that is joined to the brainstem using what we call the peduncle. What do I mean by brainstem? I mean the parts of the midbrain, the pons, and the medulla. All right, so that's good for an introduction. Now, how about the anatomy? For the anatomy, I'll talk about the 3 layers first, and then I'll mention this. So let me list out the 3 layers. Now, for the 3 layers then, I will talk about that there are 3 of them. What are the 3 of them? In the tabular form, I compare each all 3. You may wish to do it in the tabular form. If you wish to talk about them in story form, in paragraphic form. So I put here arching cerebellum. I put here spinal cerebellum. I put here new cerebellum. Now, this information may vary between neurophysio and neuroanat, okay, depending on how it is presented. But I will use that of physio just to explain this. Arching cerebellum happens to be the oldest. Neocerebellum happens to be the newest. That's the first characteristic. Arching cerebellum was also called the flocculonodular, or some others say the vestibulocerebellar. Now, what else again do we remember? So flocculonodular cerebellum layer or the vestibulocerebellar part. Now, it has connection. It has connection with the vestibular system, or yes, connection with the vestibular system. Now, because of this connection with the vestibular system, it has been noted that it causes balance and posture. Remember what the ear does for balance. Now, on the other hand, here, spinal, this one receives proprioception. It receives proprioception. What's proprioception? That sense of position, the sense of position, okay? It receives proprioception, number 1. It also helps to smoothing movement. Smoothing, S for S. And then neocerebellum is the newest part. And neocerebellum also has been helpful in the comparing, as interactive, let me put it the right way, interaction, and also comparison of comparison of plans of movement to programs of movement. So I have a plan to move, and then I compare plans to programs of movement. I consider that as a function of new cerebellum. So I've been able to tell you, active cerebellum, also called flocculo or vestibulo, it is the oldest, connects with vestibular system, has a function for balance and posture. Spinal cerebellum receives proprioception and helps to smoothing movement. The new cerebellum is the newest interaction and also helps to compare plans to program, and that's a higher function where we have a plan. I want to move my hand, then I do the action itself. Plans to programs of movement. Now you have to just list out the deep nuclei and then list out the neurons. Now for the deep nuclei, we remember the deep nuclei. Let me list out the deep nuclei. Okay, dendrite, dendrite. Okay, emboliform, emboliform, globus, globus, and fastigium. I think some people call that abbreviation. They say don't eat greasy food. Don't eat greasy food. So deep nuclei, list them out. You may not wish to really discuss each of them because it wouldn't have that time for your exam. So just list them out. But you would have to know it for MCQs, which I will discuss entirely in a separate video outside this essay long answer question series. Then for the neurons, remember, a nerve cell is also called a neuron. So neurons or cells, we have the lines of the Golgi, the lines of the granule, the lines of the stellate, the basket, and the Purkinje. So this is quite necessary for your anatomy. Okay, so the anatomy you can talk about. You list the deep nuclei. You talk about the neurons. Deep nuclei are 4. The neurons are 5. Then each of these with their characteristics. Now for functions, how do I remember the functions of the cerebellum? For the functions of the cerebellum, I remember it using 3 C's, C's, M, CB, and then M square. The 3 C's means that it helps to change the course of movement, the course of movement. Number 2, it also helps for coordination. Coordination. Number 3, it helps in cognitive function. It has a cognitive function. So you put this in segment forms: cognitive, coordination, and changing course. How about the B here for balance and posture? For balance and posture. And then how about the M? Number 1, for motor learning. For motor learning. Cerebellum help for motor learning. And the second help for muscle control at all levels. Muscle control at all levels. So 6 functions you must remember. I told you again. Changing the course, coordination, cognitive, such as even learning a new language. B for balance and posture, M square for motor learning and muscle control at all levels. How about the effects of lesion? For effects of lesion, I'm going to tell you how to easily remember that quickly. You remember that there are about A cube here, there are about 4 D's, and then ROICH. This abbreviation decodes it once and for all. A first stands for asynergia. Asynergia. Another A tells you about ataxia. Ataxia, cerebellar ataxia. And then the last A, adiadochokinesia. Adiadochokinesia. All right. How about the 4 D's? Dysarthria. All right. I'll explain each of them soon. Dysmetria. Difficulty in postural coordination. And then the D, decomposition of movement. This is when everything has failed. Decomposition of movement. Now the I tells you about rebound. The I tells you about intention, tremor. The C tells you about cerebellar nystagmus. The H tells me about hypotonia. Now, a quick one, let's recap everything again. Asnergia. Asnergia will mean the person has a jerky movement, jerky, shaking. But it can even be modified as ataxia, the drunken man. But this kind of ataxia is not that of due to alcohol, but the one is due to cerebellum lesion. Then adiadiocokinesia, difficulty to perform rapidly changing movement. Okay, I can move like this, supine connect, that kind of quick movement. When a person has that difficulty, we call it adiabiocokinesia. This actually tells you about a person having jumbled speech. His speech is jumbled speech. Dysmetria means the person overshoots or pass points. Overshoot or pass points. Now, you want to point here, he points the other. You want to touch here, he touch somewhere else. He pass points, he overshoots. Dysmetria. Then difficulty in postural coordination. The postural coordination, there's a difficulty. And then what? Decomposition of movement, which happens to be the last thing that happens. Then we have rebound. That difficulty to respond in changing circumstances, rebound. Difficulty to respond in changing circumstances, rebound. Intention tremor. Tremor that we see during movement or during activity. By the way, passive tremor is seen in basal ganglia. So intention tremor is seen in cerebellar lesion. Cerebellum is that close, that difficulty to fixate the eyes. Okay, due to lesion in cerebellum and hypotonia, muscle becomes weak and flaccid, relaxed muscle. So that is what we know for the effects of lesion. So if you are followed to this point, please endeavor is a high on facing question. Remember to go through it over and over again till it becomes part of you.